Hi, I'm going to take my mask off now because I'm alone in the room. I'm Dr. Alexia Gospodinov. I'm a physician and a member of the Good Shepherd Lutheran Church Health Committee and the Opening Committee. Today, I'm going to share some of the main points of our health guidelines for Good Shepherd events. First, we would like to thank all of you for your flexibility, your understanding, and your participation during this difficult time while we have all been called to change our routines for safety. As most of you know, we have gone to a hybrid model for church events during the pandemic. We have not been able to resume in-person worship yet due to safety concerns. In addition, the fellowship hall is being used for the food pantry and the sanctuary for the amazing virtual services that hopefully you have all enjoyed and require a lot of equipment. Unfortunately, until the virus is better controlled, hopefully with new treatments and vaccines, at this point, if we are able to return to worship, it will be very different than what you're used to. We will all have to wear masks, keep social distance, no congregational singing, no shaking hands, no coffee or eating together. So now we're going to go over some of the most frequently asked questions. Our guidelines during the pandemic are in place to reduce the risk of COVID-19 exposure and spread. We are in this together, and it's our responsibility to love our neighbors by limiting the risk of the spread of the virus. Before coming to any church event, you should think about whether you are high risk for COVID-19 complications or someone you're in close contact or you're the caretaker for is at high risk, or whether you could possibly have COVID-19 illness. In these cases, you should stay home and attend a virtual event instead. People at high risk are older adults, people with chronic kidney disease, or who have serious lung disease or serious heart disease, or obese with a BMI above 30, or sickle cell disease, or diabetes, or other conditions on the CDC website or determined by your healthcare provider. Please, if you are sick with COVID-19 or have any of the symptoms of COVID-19 or have recently been exposed in the last 14 days with somebody who has been confirmed to have COVID-19 or has the symptoms of it, even if they tested negative, since about 30% of people will test negative and still have COVID-19, or if you have been in a high-risk area within the last 14 days. The symptoms of COVID-19 include fever, chills, fatigue, cough, shortness of breath or difficulty breathing, body aches, headaches, loss of sense of smell or taste, sore throat, congestion, nausea, vomiting, or diarrhea. Whenever you come to a church event, please wear a face covering that fully covers your nose and mouth, and wash your hands frequently or use hand sanitizer, especially if you touch any surface or area. Also maintain social distance from people that don't live with you, no handshaking, no hugging, no close contact, and do not touch your face without washing or sanitizing your hands first. After a church event, if you develop COVID-19 symptoms, please contact your healthcare provider. Also, please let someone know on the Good Shepherd staff if you become ill with COVID-19 for contact tracing, and participate in church events virtually until your healthcare provider determines that you are safe to return to normal activities. Thank you very much for your questions. Please stay safe, and we are all in this together.